Hey Sarah, it's Missy. Thank you so much for meeting with Guy and I. We really enjoyed our conversation with you, and happy to answer any other questions that might come up for you. I don't know how important this is for you, but I wanted to just do a quick walkthrough of our space inside and outside, so you just have a visual of what our office looks like and the neighborhood that we're in. I'm gonna flip my camera around and walk outside first, and then come through the building. So let me flip this around. So like I mentioned, we're on a corner street. We are on a primary arterial road that connects downtown with like our hospital area and freeway. So I'm gonna come out to the corner. Sorry for the traffic noise. So this is our sign here. And looking back, I'm stepping all the way out to the corner here. So this is our little office. Like we talked about, it's a house turned office. Which makes it feel really cozy and approachable. Being on the corner, we have great visibility as well. So we have these nice big trees out front. There's on-street parking. I'm gonna walk over to the parking lot as well. Actually, while I'm here, I'm gonna span across the street. So I mentioned that I work at Massage Central. This is our office across the street, the group that I've been in since 2003. So we have the massage therapist and myself across the street, and then actually across the road over there, that little house right there with the blue sign, is Boise Natural Health. That's a friend of mine, Dr. Joan Haynes, naturopathic physicians. So we do have a nice little wellness pocket in this neighborhood. So coming over here, you can see that we are being on a corner. It's really easy for people to get in. We have for the size of our little building, we have a pretty big parking lot. There's 10 spaces and accessible parking up front. So I'll walk in this way. And I realize I'm probably going to repeat some stuff that I said previously, but I'd rather say it twice than not at all. So anyways, this is the approach to our building. There is a ADA ramp here. I'm going to try to not be super shaky. But here's the approach to our building. And as you come in to our lobby, I don't usually shoot videos, so pardon the total amateur quality of this. But coming into our lobby space, we have seating here. Office gets really great light, which is lovely. We do have some storage up front here as well. So there's the front door. I'm gonna try to turn slower so I'm not making you dizzy. Anyways, we do have a little office area here that is a folding desk that if somebody wanted to, do some stuff out in the lobby, they certainly could. Like we said, we have three. It's a cozy little house, but we have 3 offices, so pretty decent sized waiting room. This is our hallway area. Again, some exterior storage. This is one of our rooms here. Coming in here. This room has 2 chairs as well as a couch if somebody's seeing couples or families, a little more space, storage. I don't know, again, how much of this is important to you, but all of our doors are solid core wood doors. So from a quiet standpoint, that really helps to buffer. We recently just took some time between our last group and rebuilding our therapeutic community now to really give a lot of love to the building. And part of that was, new roof, paint inside and out. But part of it too is replacing all of the windows, and all of our blinds are top down, bottom up, just because it's nice to be able to let light in, but still have some privacy. I feel like those things are important. Here is our bathroom, ADA accessible. Some storage, I'm not going to step in there. The other office that we have here, this is a bigger of the spaces. I actually do have a desk that fits in that corner. It's just not in here right now. But this, this room could accommodate, since it has a couch as well as chair, could certainly handle couples, families. And then this is the other, I'm gonna close this door. There's more therapist spot and some additional storage. You will also notice that this room has actually access to a deck. We do have a little deck out there. Seating area that is private and screened off. So that's kind of nice. If somebody has some time between sessions, they want to hang out there, as long as isn't, somebody isn't in session in this office, of course. But there's that. Here's where the top down, bottom up blinds are important, I think, for me at least, because, I don't necessarily want to see the parking lot, or I don't want somebody in the parking lot to see me, even though during the day that wouldn't be an issue. But, it's nice to have some ways to customize light and still have privacy. So that is the second room. And then coming back out here into the hallway, back view of the lobby, and then coming into our third room. This one also has couch, a little bit smaller love seat than the other one, but still could easily accommodate 2 people. Close this door, and then this room has some of the best light, actually, I feel like, and little seating area. You will see that this room also has an exterior door. We just replaced all the doors, actually, also. But that is not a door that, clients would come in. If the clinician who's in this room wanted to, they could, but otherwise that would, stay closed and private. Storage area, that flat wood piece is actually a fold down desk. But if somebody, needed to do some paperwork or wanted to be on telehealth, they could do that. Those things hanging on the door, we have, just those sound buffers in each of the offices and sound machines, of course. So anyways, that is a pretty just kind of cursory walkthrough, but we did just give, like I say, the building a lot of love, replace the roof, windows, doors, toilet, sink, blinds, all those things. We just, in between groups, wanted to just freshen up all the things that we feel like are important that will also add to, really lovely space for people who want to be in house with us. So that is way longer than I thought it would be, but at least it gives you a visual, and certainly please reach out if you have any other questions. We really enjoyed meeting you and look forward to hearing from you soon. Thanks. Bye.